How can you improve libido on TRT when it's not where you would like it to be? What's the cause of low sex drive on TRT?
We're going to find out after this, so keep watching. Hi, I'm Mike with Balance by Hormones, where we support men and women on their journey to optimal hormone balance. If you're new to the channel, please hit the like button and the notification bell so you don't miss any new content.
So why do men who start TRT lack sex drive? We'll discuss the causes and potential solutions.
So we're here today with Dr. George Tiliatos, an expert in TRT and the EU Medical Director for Balance by Hormones in Europe. Dr. T has competed in bodybuilding contests as well as being a medic. Hi George, how are you today?
Hello Mike, thanks for the invitation. So it's quite common for some people that complain of, even though they're into replacement therapy, they don't feel that good. Of course, they feel better than before they were hypogonadal, but they don't feel supreme in the libido, in the sex drive department. So, of course, I'm telling them that, listen, this is not like using 500 milligrams of testosterone where you are super, horny and you have 5 times erection a day. But nevertheless, we can improve some factors during the HPTA assessment that actually affect the sex drive and the libido.
So I know you mentioned some people are on like 500 milligrams, and obviously the ones that are taking self-medicating.
When they were back using steroids, that had a super sex drive. But of course, we have a certain plateau in replacement therapy. However, we can still improve, and there is a fact that some people have super elevated HBG, elevated prolactin, and elevated estradiol. So all of these factors, sometimes they may act synergistically and affect the sex drive and the libido. So for instance, super elevated estradiol may affect the duration of the erections. Of course, super low and tanked estradiol crashed by using aromatase inhibitor right after, the day after, may also affect the sex drive. Prolactinemia also may antagonize, in natty people, of course, testosterone synthesis, but it may give you an orgasmia and lack of ejaculation, when you don't come eventually, when it's also elevated. And of course, it's HBG, which is the main regulator, and it's reversely related to free testosterone. And there might be somebody with 700 total testosterone and a HBG of 100, and the free testosterone will be below 50%. So in such cases, what do? We give certain medications. We give a dopamine agonist for the prolactinemia, such as cabergoline or bromocriptine. We may give some, now if it's super high, of course, listen, if we have an optimized testosterone but a super high estradiol and the ratio is not proportional, then we may control the estrogen by the use of mainly an aromatase inhibitor in microdosing or a SERM when you have already established a lump that resembles a gyno. Okay. Of course, we may use other supplements like zinc, creatine, or the DIM. Okay.
Calcium deglucarate as an option.
Yes. Also, you have correct. Avoid also alcohol and caffeine that also aromatize, and of course, prefer the microdosing that avoids the crashing of the. I'm sorry. In order to control estrogen, yes, microdosing is a good idea, but microdosing doesn't crash. It was the next one I'm gonna say. We need a low SHBG in order to feel high on the free testosterone and have a good sex drive. So this is how it's managed, either by the use of synthetic DHT, which is mesterolone, or DHT itself in a cream. Other androgens like DHEA, okay. But also we may use boron, which is a heavy metal, and actually we may modify the protocol by using a larger dose once a week, all right, that will crash on SHBG, will liberate the free testosterone. But I'm telling these guys that, for instance, if you inject on Monday 200 milligrams, you're gonna feel superb on Tuesday and mostly on Wednesday on sex drive, but you're gonna suffer during the weekend before your next injection. This is the benefit by using a large dose that you spike afterwards, but when the half-life is, I mean, when you are away from the injection, the date of the injection, then according to the half-life, the compound is clearing in your system, so you don't feel that good. Nevertheless, if you are using a frequent protocol of injection, then you may use Mesterolone or DHT cream that will ensure a low SHBG and a high free testosterone.
What about the use of HCG for boosting libido?
Yeah, excellent point. Yes, yes, of course. HCG will increase sex drive by increasing intratesticular testosterone. Okay, but you need also their microdosing, because if you use large doses of HCG indirectly, where this intratesticular testosterone will aromatize and will cause some issues. So yes, HCG also is an excellent idea in order to enhance, and actually works in bodybuilders that even though they're using a gram of testosterone, they face a plateau in the sex drive, so they inject in HCG.
To ask, and you've got to take it with a pinch of salt, what bodybuilders say they're taking and what's actually contained in the substances that they're taking. We don't know for sure. It might be 1,000 milligrams of one thing, it's underground, but it's in reality it was probably maybe 300 or 400 potentially.
True, but also they use 19-nortestosterone derivatives that have progestational activity, like nonzolone, trembling, that they mess up with sex drive.
They're similar to progesterone. Yeah, because I've heard of people who were, recovering after, that, and they say they had a tren cycle and it killed their sex drive altogether, which seems to be a very potent, not an ideal.
When you use these 19-OR derivatives, you should keep the ratio 2-to-1 between them and testosterone. So if you use 1,000 milligrams of testosterone, you should use 500 milligrams of them. If it's 1-to-1, you're going to suffer in your sex drive. Okay.
What about the use of growth hormone for libido issues?
It's interesting because it lowers SHBG. Of course, not to extend, it cannot be combined as it lowers SHBG like the androgens. But in the Hertog's book, yes, it's mentioned that it may improve sex drive by lowering SHBG.
People with acromegalia, they have a high, obviously, growth hormone level, and they tend to see a lower SHBG as a result. But I know you probably have to do a much higher dose than what's therapeutically used. We've seen some bloods of patients on human growth hormone who have, it hasn't made a massive difference on the SHBG level.
And another thing about this HBG can be also affected by the diet. So when you fast, when you follow IF or KD, then the insulin goes down, that elevates the SHBG. So in order to lower SHBG by diet, you need frequent meals every 2 hours, the classic bodybuilding style diet,
So some substances obviously will artificially suppress SHBG, but we also know that those people who present with low SHBG and low testosterone, they've got metabolic syndrome normally, and they don't tolerate many fluctuations at all in their testosterone level, or fluctuations in the metabolites of testosterone, estradiol, etc. So, I mean, what guys who already have low SHBG and aren't experiencing a good libido, what's the recommendation for those guys?
You mean guys that are into replacement therapy, or no, they're not treated by this?
So men who are on replacement therapy who have low SHBG, most likely they'll be dosed on a small, more frequent dosing throughout, so that helps manage the SHBG. But are there other things that could help those patients? Can those patients, even though they have low SHBG, maybe still benefit from a DHT derivative or DHT itself?
Yes, of course, yes. I apply myself now DHT cream, in the morning, 10%, 1 pump, and I believe it's more friendly rather than that. Actually, it's the authentic DHT, unlike the Mesterolone, which is synthetic, of course. I believe I'm gonna have, yes, and I'm gonna have, it's liposomal also. The absorption is excellent, and I'm gonna check out the labs to see if Mesterolone has a greater impact on my lipids or liver rather than the cream itself.
Yeah, I imagine it might, but we've seen patients occasionally when they start TRT that like HDL will drop a little bit as well when they start just from a testosterone injection or even creams.
I believe that abusing testosterone will lower your HDL, and if you don't follow cardio, if you don't eat good fats, if you have some extra fat in your midsection, this is another factor. If you smoke also, I believe androgens are a factor in order to lower HDL. That's why women that lack of androgens and have excessive estrogens, they have a high HDL until they become menopausal.
Okay. Well, I'll ask you about another scenario that happens sometimes. We'll talk to men, and a big thing they'll say is, when I first started TRT, by week 3, like week 4, my TRT, I felt amazing. I wanted to shag everything. Things were really, and now they're just plateaued. They're just flat. And this might be at, week 12 to 3 months later. Is it a matter of when they've had such low levels and they go on testosterone treatment, they get the sudden surge and maybe dopamine from their injections of the cream, and because it's a rising or climbing hormone level, that they feel the things that they hadn't felt before, and that the body just normalizes to this new level? Or is there something else going on that we need to be aware of? And
so you're implying of any saturation of the androgen receptors, or perhaps getting accustomed to the testosterone and then becoming used to it. In such case, I would introduce HCG to feel better and to increase intratesticular testosterone and improve overall steroidogenesis, pregnenolone, progesterone, DHEA, or itself introduce pregnenolone and DHEA as an extra supplementation in your HRT regimen.
Okay, so those are things you can do. But we also wanted to just review again. You said some of the causes of men having low libido on TRT. One of them, you said, is overuse of aromatase inhibitors.
You have to be balanced.
Good, yeah, of course. Could it also be that we're in lockdown still in the UK. I think things are starting to lift, but could it be just not being exposed to the right type of stimuli? Is it a possibility that if you're locked up and you just see the four walls in your flat or your house, that there's no real ability to get that visual stimulation or just being around meeting people, when that may affect your sex drive? Or do you think there's a psychological component?
Sex drive and libido engages all the senses, but of course, why we feel more sex during summertime? It's the sun, is the visual of the we wear less clothes, and we see the bodies in the beach, we start flirting, and the whole situation is way different during the holidays, and of course, yes, this miserable thing during the COVID crisis. The last thing perhaps you think about is getting laid. Or of course, there's no meeting around of people, wearing the mask, you cannot see their faces. Unless you have a sexual partner, a steady relationship, but still being under these circumstances for 1 year now, globally, I believe sex drive is affected,
We've heard a lot for some men. Even though they might have loving partners, it's just without the ability to go through kind of your normal day and exposure to other people, other experiences. You feel locked down, you feel depressed, you feel stressed, you've got anxiety. None of that really helps with the sex drive, despite how good the hormones might be, I think.
Yeah, even there are people that have a perfect, even though they have a perfect assessment of hormones, they don't feel super spiked to sex drive, and it's also the psychological thing,
What about some men on, we'll say, injections, for instance? They'll say, well, sometimes I feel really good, then sometimes I don't, and I can't control it. I could report that, not every day am I feeling like I want to crawl out of my skin and have a shag. Some days I'm really busy, some days I've got other stress in my life that it's just not on the agenda, and I guess that's normal. But there's expectation for some men to, when they start TRT, that libido has to be on top all the time, and that if it's not, there's something wrong with their TRT, there's something wrong with their dosage, some other hormones are out of balance. What do you say to those guys who are very overly concerned?
Yeah, they're becoming paranoid and obsessed about having the perfect labs, and what to use. So you have to chill out and relax. And of course, this is not like your in the highest levels of sex drive all the time, 24/7. Okay, unless you want to abuse seriously testosterone, use phosphodiesterase inhibitors, you have to become reasonable and think that, listen, you're using a certain dose. You cannot go above of this. You can yet improve your levels with some other adjustments, but be reasonable, and you are in a way better place rather than if you were hypergonadal, of course. Okay, and think about the sex also. It has to do also with other things like smell, hear, fantasize, thoughts. So your sexual partner may be repulsive to you one moment and very attractive the other moments. It's up to the brain chemistry and what the certain desire you have this special noise. Like we try to ejaculate by masturbation when we bring certain thoughts in our minds in order to have this tunnel vision. So the same goes with having sex. It's about a whole act. Not just pushing back.
Absolutely. And then the use of PDE5 inhibitors, Cialis, Viagra.
It doesn't improve, of course, sex drive. It's just an artificial blood flow, nothing else.
Is there no extra feedback that the mechanism of getting an erection may have a feedback that also helps with the cascade, or is it purely plumbing?
I've experienced a huge erection by Viagra or Cialis or Levitra, but I'm not really interested to penetrate.
That's true. You can be just sitting in your car, sitting on the sofa, and you may get a spontaneous erection as a result of blood flow.
I believe it first comes from the upper head controls the lower head, and of course testosterone improves nitric oxide. So if you have good vessels and you're not diabetic, you don't need Viagra. You just need testosterone and nitric oxide reduction.
Interesting, because we'll see some younger patients or patients with really good vascularity who will have low testosterone but can still maintain an erection, but there's no desire. So where an older patient might, and even the levels are higher, if they've got really good vessels, they don't need a lot of testosterone in order to get those erections.
Yes. Exactly, those drugs were made for elderly people that have vascular issues in the cavernous bodies, or atherosclerosis, or diabetic vasculopathy. So that's why they need the extra blood flow into the penis.
Should a patient be concerned or worried if they need Cialis or Viagra, or perception of needing it to have the best sex possible? Is that something, some men have said, I want the testosterone to do the heavy lifting, and I don't think I should have to, I'm worried about having to be on this Cialis or Viagra. Is that really a problem, or?
I do not blame them if you want to enhance it and take it a step further, but the basic stuff is TRT and HRT. THT along with testosterone, okay, and proviron. These are the good stuff, the main thing that improves sex drive, because DHT also works in the head, and we know that testosterone, as Morgenthaler says, is a cerebral hormone. Okay, it affects the limbic system, and this instinct of having sex, in reproduction. And of course, you're gonna use these drugs that improve the blood flow, but nothing substitutes testosterone, which is the main androgen. Okay.
Okay. All right.
It's like when women use estrogens in order to have sex drive also.
From the estrogens that they're using will improve it.
Yeah, because menopausal women lack of sex drive because they are crashed on estrogens. Of course, they need a little bit of testosterone, and we also need a little bit of estrogen. But the main hormones are responsible for the main libido,
No, definitely. I noticed a big improvement in my libido going from a young man and had low levels of testosterone and being on treatment. It did make a big difference. Obviously, when you're younger, I think there's more resilience in the body compared to a middle-aged man that's starting. But even from the patients that come through our service, as you've seen as well, you get a nice uptick. People say, the libido's back, the life is back, the energy's back, all the positives that can happen. It's almost like going through another puberty from that point of view.
You feel reborn, yeah, exactly, second puberty.
Yeah, that's what I've seen. So to summarize then, George, you're talking about improving one's libido who's on TRT, why that libido may not be optimal, we talked about expectations of being on TRT and knowing that you might not always have a libido that's at the very top all the time, every day. And I suppose if it were, you wouldn't know the difference between low or high if you're always at the same level. So I think that the different thoughts that you had, the different options for treatment were, in some cases SHBG may be too high, your free testosterone isn't high enough. There may be certain agents such as dihydrotestosterone cream or misterolone that may be able to help, not to mention prolactin that's too high can also be an issue, or estradiol that's too low.
It's more factorial, yeah, they affect one the other,
There's many factors that affect libido.
Psychological issues,
Psychological issues as well, any sort of stimulus that you might have from your surroundings, which is psychological. So there's so many factors, but there may be a few steps to tweak your TRT that may help, or there may be causes behind that. So thanks again for watching another Balance My Hormones video with Dr. George Tiliatos, and we'll see you next time. And don't forget to like and subscribe to the channel, and we'll have more content next time. So see you then.